Have you ever had a dentist discuss your airway or snoring? Probably not. At my dental company, that's one of the first things that we evaluate is the airway, because it's amazing how the airway can affect everything that we do in dentistry. So if our airway is unstable, then that often translates to an unstable environment in the mouth. Because I've seen patients with periodontal disease that if they have a compromised airway, and we're doing everything that we can to help them with the bone loss and the bacteria that's in there, but we haven't fixed the problem or even made the problem with the airway better, then there's a continuing effect on poor oral health. It's the same thing with the bacteria in their mouth. So at my dental company, one of the best things that we do is take a big picture view of what's going on with the whole body and not just the mouth. When we look at that and we can evaluate the airway and see that it's compromised, then we can start back at the root cause of a lot of the problems that's going on in the mouth. So we see a compromised airway is affecting everything that we do. So if we're not breathing correctly at night, then it means that we're not getting really great restorative sleep. So that restorative sleep, where our mind and our bodies recover, is so important. So the right candidate for sleep apnea or upper airway resistance is somebody who's not getting restorative sleep, somebody who feels like they wake up extremely fatigued or tired, somebody that has a bed partner that knows that they're stopping breathing at night and they all of a sudden wake up gasping. That's a definite red flag for sleep apnea. If you are snoring, that's another red flag for at least upper airway resistance syndrome and possibly sleep apnea. There's the traditional treatment of a CPAP, and that's often what physicians will start to do. There's what we call mandibular advancement appliances. So mandibular advancement appliance can take the lower jaw forward and hold it there while you sleep and increase the airway space with that. You can go into treatments where you can lift and tighten the soft palate. And so when we do that, that can increase that airway space. The Soleil Sleep will lift and tighten the soft palate temporarily. It lasts for about a year to a year and a half. The cool thing about that and what we do here, and you can get that done here, is it kind of gives you an idea if you want to go on and actually do the surgery so it's permanent. So ultimately what we want to do is create lasting change. Somebody who has sleep apnea at night or airway resistance at night, they're having problems during the daytime as well. So if we can create a permanent change, then they're going to get more oxygen and more restorative sleep when they sleep, but they're also going to get more oxygen during the day and be able to perform better and have more energy throughout the day because of these permanent changes that we can create. If you want to know more about finding out how to treat sleep apnea or upper airway resistance or even snoring, give us a call at my dental company. We will guide you to a more restorative sleep.